Hi all, I'm Dr. Vinatha. I'm the Clinical Director for Obstetrics and Gynaecology at KIMS Cuddles, Kondapur. Today, on occasion of Women's Day, it is our pleasure to share with you this topic on preventive gynecology, which is very much needed in the current scenario of our lifestyle, that we need to step back and think of our own health. So let us discuss what can be done to prevent most of the diseases in gynecology. So when we think about management of any problem, what is management? For anyone who tells about management, next slide please. Management is all about anticipating a problem, planning, organizing, command, coordinate, and getting the control. So, this is applied for any aspects of management. When we take this into medical science, what does it mean? And what does that management mean to us in medical science? Next slide, please. It means to us the recognizing, management, resolving issues regarding the diagnosis and treatment and therapy of diseases as per in accordance with known guidelines and treatment algorithms. But our concept of current management also revolves around prevention. That is when we get the control of it. Prevention of a disease is if we understand a disease, how it comes, and we can see something that we can do proactively, that we can prevent that disease happening to us, then it's called primary prevention. Secondary prevention is something that we are trying to recognize that very early and treat quite quickly, so we will end up having less problems because of that disease. So let us see that how we can get the control of it. Next slide please. So control of a disease we can get by only prevention. So let's start from childhood. Let's start walk through all the ages of a womanhood, and see what all problems can be there and what we can do to try and prevent some of those problems. Start from childhood. So start inculcating very healthy lifestyle for the kids. So these days now lots of processed foods kids are eating, and they are having childhood obesity more than ever before. So there is something that we are feeding them, we are making them less active in their part of the lifestyle. So trying and get those healthy habits from very early on, so they can be quite used to that healthy lifestyle from the start. And bladder habits. So many women will have lots of urinary infections, urinary incontinence later on in their life. Some of them can be brought on by a very early stages of bladder control problems. Like in childhood, many children will not go to toilet when they go to school. From the time they go to school till they come back home, they will not use the school toilet. There might be so many reasons they will tell. Some will say, I don't like the toilet, I don't like the smell, I don't like the privacy. They will have so many reasons, but we try to understand, address all those reasons. But we have to also tell them that this long time of holding and not passing urine for many hours from morning to evening is also not good. The bladder will muscle will get a little problematic and later give problems of incontinence and things like that. So we can educate them from childhood. So regular bladder habits are taught. Next slide, please. And let us move on to preteens. So, what problems are usually there in preteens? They might not have much problems, but we have to prepare them to start of menstrual cycles. So to educate them about menstrual hygiene. These days, preteens are starting having periods quite early. Previously, 12, 13 is supposed to be the age when female children will start having periods, but nowadays it's gone down to 11 or now 10. So we don't stop if it is 10 and over, but if it's still less than 8 or 9 years, we try to evaluate them and treat them. But otherwise, 10 and over, we are not stopping the periods. But for such a young children, it is our job to tell them about menstrual hygiene. When I tell about menstrual hygiene, there are lots of things that we can teach and train them. Next slide, please. So, proper feminine hygiene. it is applicable for everyone. So I know we are teaching the preteens, but that is for our life also. So later on in our life. So to tell them, take shower regularly. Some in winters they don't feel anything. They will just go without having shower for a day, like that. But it is important that we maintain that regular rhythm in their life. Take shower regularly, change underwear regularly, especially during menstruation. When there is some stains, change them rapidly. Don't go with the same thing. And clean the genital area properly with warm water and soap. No inside washes are not generally recommended, but to keep that area dry. Um, because sometimes all the time wearing the tight leggings and tight underwear and tight dresses will not let the air flow very easily. There will be all the time some moisture that is keeping the area wet, that will increase the chances of fungal infections, that will increase the chances of few infections. So we want to avoid that, and so we have to advise them change the napkins frequently so the wetness is not staying that like that for a long time. And next slide please. And no strong washes. There are so many people who use perfume products and everything, but make sure that whatever products you are using are not strong on the skin there. And no deep cleaning, and don't share towels and underwear. This is something that we have to teach in the family itself. But still, though your family, do make sure that you are not using the same towels, so you don't spread the same infections when one has. So this is some points that you can teach your children, and we move on to teens. Okay, next slide, please. So in teenage, what all we have to do to prevent something? Here the problems are a little different. Teens, few years ago were having different problems, but teens this generation are having all different problems. So most of the teens these days are already into sexual practices. So we have to educate them about safe sex, and avoiding unprotected sexual intercourse to reduce the infections, and avoiding unwanted, unintended pregnancies. And if at all unintended pregnancy happens, then to have a safe abortion if they don't want to carry on, than going for some unsafe abortions that will increase the chance of complications, and their life risk will be increased. So we generally, at least teach them safe sexual practices and about contraception, so they don't get in there in the first place. And contraception, they can have various different types of contraception, and educating them about different methods, what can be used, and everything might protect them from having unwanted pregnancies. And HPV vaccine, this is cervical cancer prevention vaccine. So this is now available in so many countries. Some countries are giving as a routine vaccination schedule for all girls from 9 to 14 years. But in our country, we still don't have that in our regular vaccination schedule. It is expensive, but if you are able to afford, please give this vaccine. 9 to 26 is the one that we are still giving, but best is to give 9 to 14. If we cross 15 to 25, still it is still better to have the vaccine than not to have vaccine. But after 26, it's somehow not protective, because most of the time by then already the first sexual intercourse would have happened, and the chance of you getting this HPV virus is already there. There are some HPV viruses that are more prone to give you cervical cancer, and this vaccine aims at providing cover for those important four viruses that can cause cervical cancer. So when you have a girl child who is aged between 9 to 14, give them HPV vaccine. If you miss, give them at least 15 to 25 years. Okay, next slide, please. So now moving on to a little 20 to 40s. So what are all concerns that we might have? Most of the time, this is a very important period in any woman's life. And this is very difficult period also. Most of the time, there are so many challenges for the new generation women to balance their career, their family. They need to have children at this age. They need to stabilize in their career at this stage. So many times they put family at the last, and they try to get stabilized in career first. And so later on they develop late pregnancies, and so complicated pregnancies and all sorts of complications. So what we can do in this age group is to try and get adequate and proper healthy nutrition and regular exercise. If you are someone who is getting used to smoking, alcohol, drugs, lots of caffeine, try and stop at very early at this stage itself, so we won't get into those habits which might put our lives at risk in future. So trying to inculcate, still we still have chance to change our lifestyle, change into healthy habits at this age, and not get into any drugs or illicit drugs or anything. And stress, these days stress is implicated so many diseases, and everyone is talking about stress. This is how we feel about it. Like, in any particular scenario, some might take it very lightly, they won't feel that stress. Some might feel for small things so much of stress. So it's exercise will indirectly help you in dealing with stress in a better way. So always make sure that there is some time in every day of your life for exercise, making sure that regular exercise is in place for you in your daily routine. Next slide, please. And plan pregnancy early on in your life, and don't delay this to late 30s, because I know we like to call it as age is just a number, and we always feel young at heart, mind, but unfortunately our ovaries and uterus will not feel the same. We are known to have more problems, and suddenly what we have observed, the moment you hit 35, everything will suddenly, your problems will start to go up, and your fertility will start to go down very rapidly in a steep curves. So, and don't think that, okay, doctor told 35 years is the one that makes everything difficult, so I will plan at 34. Sometimes we don't know. These days we are seeing early menopause or problems with fertility very common than before. So we don't know, we cannot predict who is the person who can have fertility problems. So always try to plan a little ahead. So if you have problems and you have fertility problems, you have enough time to deal with it. And if you are lucky, no worries. If you plan a little 2-3 years early, it doesn't matter. But 20s, late 20s is appropriate time, which most of the time we are not seeing pregnant ladies in this age group. Most of the time we are still seeing women in 30s, as that has become our norm and routine. And so our complicated pregnancies are also on the hike. Okay, so and anyone who is planning or thinking of pregnancy, start using folic acid supplements, because folic acid is one essential element that every woman should take when you are planning pregnancy. This will help in neural tube development of the baby, and that development of the baby will start very early, means from 3 weeks itself. 3 weeks is even before you miss a period. So if you are have a period, and by the time you know you are pregnant, you should miss a cycle. So 4 weeks is the minimum time you test for pregnancy, but the need for folic acid has started already at 3rd week itself. So always have folic acid even before you are planning pregnancy. And there is no harm in taking folic acid. Some countries will fortify all the foods with folic acid, so nobody will go deficient in folic acid. But we cannot rely on fortification of foods as a general measure for public in altogether in all foods. So we still recommend folic acid supplements to everyone. There is no contraindication whatsoever that if some women cannot take folic acid for this. So I think there is almost no contraindication. Everyone can take folic acid. And it is not a prescription medicine also. It's freely available over the counter medicine that you can start taking. Okay, next slide, please. So in 20s to 40s, apart from pregnancy and pregnancy care, always have regular checkups. This is the time where pap smears are also have to be started from 25 till the age of 65. Everyone should get a pap smear once in 3 years. So this is a cervical cancer screening program. Prevention is by HPV vaccine. Screening is by pap smear. Nowadays, we also have HPV testing for screening. HPV, we can do some test to find out whether we have HPV or not, and that high risk HPV. And if you have that, you will be frequently monitored. But if you don't have it, then this pap smear and HPV testing can be done once in 5 years. But if you don't have HPV testing, do pap smears once in at least 3 years till you're 65. So get regular checkups done. And if you face any issues with irregular periods, abnormal weight gain, or anything, or in between periods, if there is bleeding, or if you have bleeding after sexual intercourse, don't ignore these problems. Get help early. And if you have any of these problems with lots of caffeine intake, alcohol, smoking, drugs, please try to stop it or convert to decaffeinated drinks. Next slide, please. Now we move on to over 40s. We don't like to be in this age, but we have to face. Okay, so at this stage, we still have problems, and this is the time where like a few cancers are also on the hike. 45 to 55 years is a peak time for us to develop breast cancers. So at this stage, apart from pap smears, we also include and add self-examination of breast and mammograms. Mammogram is an X-ray that we take for the breast, and it will be done with any annual check or anything. But we need to get it done. In few countries, we are now delaying it to 45 starting age of start of mammograms to 45. Previously, it used to be 40. But when you get a regular check, we can take history and see whether you are more prone to get breast cancers or not, taking family history into account and everything, and then suggest if you need it to start early. But now, as a routine, we are advising if you don't have any risk factors to start breast screening at 45 also. But when you come for checkup, discuss with your doctor whether it is okay to start at 45 or at 40 only. Okay, and self-examination of breast, even before you start mammograms or though you are getting mammograms, after every cycle, once examine breast yourself with the palm of the hand, going around all four sides of the breast and checking the nipple if there is any discharge or pus like a discharge, or in the armpit to see if there are any nodules or any lumps are identified, then come early. Despite you having mammogram before, and despite us saying everything is normal, if you identify in your self-examination that things are a little different, or you notice something different recently, then come early. Then we can identify things a little quicker and we can sort out in an easier way. Next slide, please. So menopause, most of the time, it's the late 40s, early 50s that is implicated for menopause. And menopause might just come and go without much hassle for some women, but for some women, lots of changes will happen. And there might be so many hot flushes, night sweats, disturbing mood swings. All this can be there for some women. But those who require hormone treatment for these problems should do so under doctor's guidance, because hormone replacement will have lots of advantages. It can reduce the risk of heart disease and bone problems, but at the same time, we have to balance that with the risk of other things like breast cancer, ovarian cancers, and things like that. So, always it is a prescription after doctor's suggestion. So, hormone replacement can be given for concern in around menopause time. And this is also the time where we think that it's more of prevention and also early diagnosis and treatment for diseases if they start. So it is now necessary that you have to have regular healthy checks, maintain your diet and exercise, don't go into any of the illicit medications, alcohol, drugs, anything like that. And this is the time you plan for older age, where you can have mental health problems, Alzheimer's, forgetfulness, and memory loss. So you start practicing some mind stimulating activities, solving puzzles, Sudoku, like that. So we tell all this for preparation for our later stage. So our Alzheimer's or dementia will get delayed. Next slide, please. So get regular health checks, maintain hygiene, maintain motility and active lifestyle as long as possible, because the moment our mobility will come down, all the risks will increase. So it is important that we maintain our mobility and activity. Any part of our life till we live, I think we should start think of movement. And incontinence, many people will think it is an age thing. So everyone in the old age will get incontinence. Remember, it is not normal to have incontinence. It is not. It is. You don't have to accept that it is our age thing. We have to now adjust to this new life. No, there are so many helps available. Don't think it is normal. Don't put up with it, and don't go, like, people don't go out because they have now have incontinence. There are so many options and available. So many treatments that are available to try and help women with urinary incontinence or fecal incontinence. So making sure that you have options, you are aware of your options, and trying to do pelvic floor exercises after menopause, especially because that is when things will start to happen, when there is no hormone support. So this will reduce our risk of incontinence. But if you do have incontinence, don't put up with it. Come to a doctor and we will find a solution or some answer and how to have a better quality of life when you have this problem. Okay. Next slide. I think we're almost done with all our preventive things. So calcium supplements is something that I forgot in this presentation. Those who are beyond menopause have one calcium tablet a day for protection of bones, bone health. So one more important thing is at the time of incontinence, or sometimes you have so much of urgency that you just have to go and pass urine. If you don't make it, you will leak. So you run or you make it everything fast. And in really old age, you might have falls by the time you reach the toilet. So the falls will increase your chance of bones breaking and major problems and complications. So to avoid all this, maybe our incontinence episode should also come down with whatever help that you can receive. And bone health can be improved by calcium intake and general activity and lifestyle things. So with this, I think I will conclude the presentation on all the measures that we can take to prevent major gynecological problems in every walks of our life throughout from childhood till menopause and beyond. And if there is any questions or any further discussions you want, we can please put up in the Facebook thing and I will see and answer if there is any questions. Thank you.